Hello again, this is Tristan Moore. I spent the first video kind of introducing who I am, my family. I gave some backstory on my birth defects, that I'm a patient advocate, usually helping others quite a bit. I enjoy that, having been in the medical system for off and on most of my life. I like to help others through it because most people don't ever have to deal with that. And most of the time when someone does have to deal with some kind of major or even scary prospective medical issue, when they don't understand the medical system, the jargon, things that they can do to arm themselves with knowledge, they don't even know where to begin to get knowledge. They're left with the myth that you have to be a doctor to understand your own body, and that is bullshit. I am here to tell you that I have gotten so good that I can look at my own scans and tell you what organs are where. I can see my cysts. I was able to point out my own tumor. And that's what this video right now is going to be about. My Facebook friends and family are very supportive, and again, because I'm an advocate, I don't normally talk about my own health issues publicly in kind of a way, especially because I'm a full-time working person, and I am in school full-time, getting a bachelor's degree in healthcare administration from home, thank God. That's going very well. It keeps my mind busy. I don't like negative attitudes either. I think that's one of the other reasons why I'm usually very private about my health conditions and my health situations. Used to, and I would be more open about it and reach out. And people are good-hearted. They're very kind, and I think sometimes people just don't know what to say, or they consider this is going to be a problem for the rest of your life. You're not going to be able to do this anymore, and your entire life is on hold, and this is going to be painful, and it's going to be horrible, and just no, I reject that. I reject that. I do have some lifelong conditions that I'm going to have to deal with, but I prefer it for others to speak life into me. I have endured a lot, and I have had time periods in my life where I allowed the stress of those conditions, the treatments of such, many of the misdiagnoses that occurred in relation to this stroke, and some of the flat-out verbal abuse during the process of finally finding a smart physician to take care of such an obvious problem, caused a little bit of post-traumatic stress for me. Again, that's, I think, one of the reasons why I became an advocate, was to cope with that. I'm still a bit of an anxious patient, I admit. Even as an advocate, I have iatrophobia. It's also known as fear of doctors. If I don't know you, if I don't trust you, if you have bad bed manners, if you don't let me know my own numbers, I want to see my own data. And I like to understand my own data, because at the end of the day, this is my body, and I have to live with it no matter what you do as a physician or as a care provider or whatever. I have the right to know anything about my health care that you know as a provider. That's what I pay you for. And I like to be able to make full decisions about my care. Sometimes there have been some that, like within my neck, I did have some foraminal narrowing at some point. It was causing some problems with my bladder. And I had one neurosurgeon that I spoke to, and he was really gung-ho wanting to try out some surgery in that area. But the anatomical planes are very complex, cannot even be visualized properly. And I told him, no thank you, is there anything wrong with my spinal cord? And to which he said, no, it is widely patent. Okay, well, in that case, I elect not to have that surgery, because I elect to be not quadriplegic. I do not want any if it ain't broke, don't fix it. So I've later learned from one of the top neurosurgeons at UT Southwestern that that was a wise decision to make, and I should not ever attempt to touch the neck area or allow a surgeon to touch that area unless there is specifically significant cord impingement. Basically, where I was being, there was a risk of quadriplegia already in progress, which there is not. I don't have any pain. I have torticollis in some areas. I need chiropractic treatment. Thank you to my parents for not putting me through surgery in my youth. With the severity of my scoliosis, it's very easy to have made the decision to do soft spot spine surgeries. My parents were always very good about, even though I was a young child, they didn't treat me like just because I was a young child I was stupid. I got to be there with my parents when we were talking to doctors, going over risks and blah, 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 and my parents let me have my opinion. They ultimately made the decisions that were best for me, like having my ears cleaned out. I always said no, but just because it hurt. But because of my no and being told, telling my mom why I said no, she was able to make better clinical decisions to make my trips to have my ears cleaned out easier. So I respect my parents for that. And for all of you out there with children with health conditions, they're not stupid. And I have very clear memories going back to 4 and 5 years old, sitting with my parents and the doctor. And I think that the exposure helped me be less afraid of the procedures I had to endure, and it built my confidence in the staff taking care of me. And my parents were showing respect for my autonomy as a human being by giving me the choice of whether or not to make modifications to my body that would be very risky or not. So I did not have a rod procedure. We chose physical therapy. I wore a Milwaukee brace for 9 years. I think 9 years. You can Google it. Just let's just say I'm glad I'm not wearing one of those anymore. But it kept my curve from becoming required a surgical requirement. I've had a lifetime of chiropractic treatment, which I love that stuff. It feels good one way or the other. I know some people think that chiropractic treatment is hoaxy, but you're looking at a woman that should have been in a full rod years ago, and I'm not. So I attribute that directly to my chiropractic and physical therapy. During the birth, or during my pregnancy of both of my children, there was a lot of stress put on my spine, and there was a lot of pain because of things didn't move like they should, and easily fixed by chiropractic treatments. And then after my kids were born, things were put back where they belonged. And then disc degeneration, I don't have anywhere near the amount of disc degeneration as I was expected to have. My mother, even though I was not allowed to be involved in high impact sports, my mother looked the other way, so to speak, not in a bad way, but she allowed me to pursue my dream of figure skating, and I did that for several years. Enjoyed it. When I became a parent, I became quite thankful, realizing that that must have been difficult for my mother, knowing that if I was to hit my head the wrong way, it would not be good. But she was not going to let my situation keep me from living and doing the things that I really wanted to do. And so in that vein, that will a lot of times be the undertone of my message or my videos that you will see. Thanks.